Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us for another segment. In this segment, we're going to be continuing our series with Blooms The Chemist. We're going to be speaking with Mr. Eric Chan this morning, head of pharmacy at Blooms The Chemist, as you know, Australia's leading community pharmacy. He's joining us here on the program to talk about a recent white paper detailing their response to the COVID-19 pandemic. This paper is entitled Lessons Learned from the Frontline of a Health Emergency. This paper includes among many other topics, pharmacy practice, contextual background to the role of pharmacy during the pandemic. Welcome to Health Professional Radio, Mr. Eric Chan.
Thank you for having me. Thanks, Neil.
Well, head of pharmacy at Blooms The Chemist. Talk a little bit about your role there at Australia's leading community pharmacy.
Absolutely. So, Neil, Blooms The Chemist, we are a community pharmacy chain. We've got 100 pharmacies across Australia, predominantly in New South Wales. We're really focused on making sure that we are a member of the community. We're an integral part of the community. Being head of pharmacy, it's no easy task. We've got 100 different pharmacy teams to help assist to make sure that they all provide consistently, day in, day out, the best healthcare and advice to all the members of our community. It's something that I'm really passionate about and really try to help drive the way the industry is going to head towards with regards to pharmacy and how the community sees us as a healthcare professional.
This COVID-19 pandemic basically equals challenge after challenge after challenge. From a pharmacy standpoint, what are some of the challenges that you first noticed there at Blooms The Chemist?
Yeah, Neil, so the first thing, being a community pharmacy business, we are at the front line. With COVID-19, how it's impacted different communities and different countries in their own way. For us in Australia, what we found was we needed to be that pillar of calm. We needed to make sure that when our customers came in to our pharmacies, we remained calm so that we could make sure they could stay calm as well. The most important thing, the biggest challenge that we found was that spike around March. Around March, that's when we started to see people getting a bit more anxious. They bought into the panic buying side of things. And when we're talking about medications are something that people of our community, they are expecting to get that medication whenever they come into the pharmacy. Mm-hmm. They're having a medication shortage. It's almost unheard of. But when you're starting to think about people having panic buying, it can be quite a difficult conversation to have. Now, that's one of our biggest challenges really is to say, well, guys, we had to talk to these people, have those difficult conversations. So the government has put in these restrictions or limits on the amount of medication that each person can purchase, which really helped. That way we could ensure that we could give access to medication to all of our members of our community, not just the ones who came in first.
Normally, the pharmacist has more of an opportunity to connect with the customer, giving advice, opinions, instruction. Where does the pharmacist fall in to play when the fear, as you said, the panic buying? How does the pharmacist set at ease the customers during a time of high fear?
Yeah, that's a really good point. So the pharmacists, all of our pharmacists who are on Frontline, and being such an integral part of the community, that's one of our main goals at Blooms The Chemist and our differentiating factor compared to the other pharmacy brands out there. We needed to make sure that they were equipped to have conversations. We've got the medication here. We understand that you will be needing this medication every month. We're going to forecast and make sure we have enough supply for you for the next few months. So don't worry about stock. All the medication here, we're going to be making sure we look for the community. We've got really good communication with our wholesalers and our suppliers to make sure we have a continuous, uninterrupted flow of medication. And that gave them a bit of ease. And, you think about the people who probably are less advantaged. They might be immunocompromised. They might have to be looking after a family member, and they can't actually go out of the house. So pharmacy, we really put our hand up and said, hey, if you like, we'll organise free delivery. We'll talk to your doctor for you. We'll bring the doctor into the conversation, reduce the need for face-to-face contact, and that really helps. Adhere to the social distancing. We try to minimise that face-to-face contact, make sure that everyone stays safe. And not just from the customer's perspective, but also from our people's perspective. Being the front line, you're not sure what's going to come in, day out. So it was really important that we provided them that guidance from a support office perspective, from the Blooms support office, to make sure they knew what was going to come through the door next day.
What about challenges with compliance from a pharmacy standpoint? I mean, you're bogged, for lack of a better term, bogged down with regulations, of course, for our safety and yours as well. But with all of the added regulations, what types of compliance challenges are you finding across your network?
Yeah, so compliance with medication always go hand in hand. The physician or the prescribing doctor, they always want the patient to be taking medication regularly, so that way, but when they reassess their health or their condition, they make a judgment, a call to say, hey, this patient's been on this particular medication for a period of time. With that information, I can guide the treatment further. So when this happened with COVID-19, we're thinking about people have got so many other things that they're worrying about right now. They're worrying about their safety, they're worrying about their health, and all of a sudden you go, well, there's this unknown thing that's going on around being COVID-19. So where does the compliance of medication sit? It kind of starts going down a couple of rungs on the ladder of priority. So that's where the pharmacists and the pharmacy teams really come in there to make sure that they have different touch points with our customers, to just check in with them, to say, hey, is everything okay? Do you need anything else? Make sure that that's one part of their mind, that box is ticked. The medication is all there, reducing the barriers for them to continue their regular medication.
As far as managing your inventory, have you found that there are new opportunities for to more efficiently manage your inventory? And do you think those opportunities, now that you've discovered them, will be embraced going forward in your network as a pharmacist?
Yeah, Neil. So when we're talking about inventory, we're talking about embracing technology. We've got a big focus on making sure that we can provide access to medication for our members of the community. And when we're thinking about adhering and also just thinking outside the box with technology, we were thinking, well, how do we make sure that our customers feel safe? How do our customers make sure that they have got the medication that they require? We were able to forecast moving forward, have those daily conversations with our suppliers to get updates and make sure that we could just give the pharmacy teams an ease of mind to say, hey, rest assured, the support office, we're helping any way we can so that you don't have to worry about the inventory. We'll give you updates as you need them. You guys do what you do best. Make sure that the team's safe, make sure the customers feel safe, and we'll get through this together.
Eric, give us a website where our listeners can go and learn more about Blooms the Chemist and more about this white paper as well, entitled Lessons Learned from the Front Line of a Health Emergency.
Yeah, so from bloomsthechemist.com.au, that's our webpage. That's where you can access all the resources there. You can understand more about what we're doing here in Australia and how we've learned a lot, and we're more than happy to share it through our white paper. And of course, if there's any other further questions, always reach out to us. We're happy to share. It's a community here, and as healthcare professionals, we need to learn off each other. And we'll be the first to say that we're always trying to find ways that we can provide assistance, not just to our team members in our 100 pharmacies across Australia, but also to those communities and those customers that need it most.
Eric, I appreciate you joining us here on the program.
You're very welcome, Neil. Thanks for having us on.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Mr. Eric Chan, head of pharmacy at Blooms The Chemist, Australia's leading community pharmacy. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au.